Hello, everyone, and thank you for joining us in this first seminar of a series of seminars we hope to do here at Panama Fertility. I'm Dr. Mario Vega, and I'm going to be talking to you about today maternal age and using egg donors, something that we do frequently in Panama, and this is something for which patients fly from all over the world to Panama to pursue. So I'm going to be talking about our clinic, a small welcome and introduction, then about how maternal age can affect the chances of getting pregnant with regular IVF, in which patients we may need to do donor egg treatment, and then how it works with us in Panama, which I know is a concern for many patients about flying to Panama and doing a treatment. Also, a little bit about our donor egg program. So our clinic, Panama Fertility, is a clinic that has over 30 years of experience. We've had over 10,000 babies born. We have 2 US trained fertility physicians, a dedicated international donor egg program coordinator. And something that we're very proud of is that 96% of patients would actually recommend Panama Fertility to a friend. We are the first clinic in the region to offer a refund if you don't get pregnant and if you don't deliver a live birth. We are also the largest clinic in the region, for which gives us the experience to be able to talk to you about all the treatments possible. So, how does maternal age affect fertility? This is a topic that many of you know already. Perhaps many of you have been talking to your fertility physician in the US or elsewhere about possible treatments. And well, this is a graph that nobody likes to see. However, it's a very important graph. So what we know is that women are born with a limited number of eggs. Every month, this number decreases, unlike men, where they basically make sperm every month. So the ability to conceive for women start declining in the mid-20s. There's this breaking point around age 35 in which we see there's a rapid or more rapid decline in fertility for women. So ovulation halves because there's also less eggs to choose from. And what is important about this graph is this is for just regular fertile women. Does not include people who already may have an issue and who may have their fertility decline even faster. Something that is very important is that after age 35 and between age 35 and 40, the chances of infertility start to rise dramatically. So between 35 and 40 is really the ideal age to seek fertility treatment because the success rates are really, really good. After age 40, the success rates start declining very rapidly with assisted reproductive techniques. At age 40, the chance of getting pregnant meets the same chance of infertility. However, we need to understand that each patient is unique, meaning that someone who's had a live birth in the past is not comparable to someone who's never had a baby before, or someone who's had issues like endometriosis or PCOS are not comparable to someone who doesn't have those issues. So we need to look at every case individually and come up with a personalized treatment plan. So, like I mentioned, your ovarian reserve is going to determine, in reality, what treatment is best for you. This is everyone, or not everyone, but a lot of us in the clinic, and these are going to be the faces you're going to see once you travel down to Panama. I am the scientific director. I trained in New York. I worked in New York for 8 years. After that, I came to Panama to join my father. So this is a family-run practice. My father has been in practice for over 30 years. I believe it's 35 years now. And he has built what is now the largest clinic in the region. Of course, with the support of all our staff, which includes the IVF coordinators, the embryologist. We have a very good financial coordinator and who also acts as a concierge. So Daniel can take care of all your needs before coming to Panama and while in Panama. So your first free telephone consultation is with a medical doctor. We're going to be taking a detailed medical and lifestyle history. We're going to be doing the tests in your home country. We're going to do a free video consultation with a fertility specialist. Your treatment plan is always individualized. And also, you're going to get a free consultation with a financial coordinator to also learn about all the programs that we offer and also to be able to fit your budget. So when we're treating older patients, we're looking for subfertility issues. We look at stuff like ovarian reserve. We need to consider egg health because so far I've talked about the egg quantity. However, the egg quality is also that also affects. So someone who is 41, 42, for example, may have a lot of eggs, but those eggs are going to have a quality issue most of the time. So that's also, that is something that's very important. We always want to try first with your own eggs. So we're not going to go straight to donor egg. I believe we've never done that. And also because most of the patients don't really want that. Everyone wants to try with their own eggs first. So that's something that we usually try first, but the patients that come from the US, from other countries, are patients who may have already been told they need donor eggs because they have already failed IVF cycles. So we have to look at the whole picture to come up with a personalized plan, of course, always with the patient's input and always taking into consideration what the patient prefers. We're very transparent about the likelihood of success with donor eggs or with IVF with your own eggs. And someone who is 42, for example, we may quote a 10% chance of IVF with your own eggs working and a 60 or 70% success rate with using donor eggs. And people who have not tried with their own eggs usually go for that 10%. And that's okay, as long as you know the percentage and the likelihood of success rates. In people who have failed several cycles in the past and who are older, meaning over age 40, those people we may recommend using donor eggs. Our donor egg program is something we're really proud of. This is the largest donor egg program in the region. We do over 100 cycles annually. We have pre-screened donors ready to be selected who are already medically, genetically, psychologically cleared and who are ready to donate. We have a fresh program as well as a frozen egg program. Something that sets us apart is the fact that we have the first refund program in the region. So essentially, we are so confident of our success rates that we tell patients that if you do the program, the refund program, if you do 4 donor egg cycles for 1 flat fee, if you don't achieve a live birth, we'll give you 100% of your money back. How we can do that is because we believe our success rates are very, very good. So 70% pregnancy rate per transfer is something that we're very proud of, something that we work very hard towards to, and this is above the US average. So who's gonna need donor egg treatment? We're gonna be looking at women who are unable to achieve a pregnancy using her own eggs, someone who's failed IVF cycles in the past, someone who is over age 40, someone who may have premature ovarian failure, poor egg quality, or if they had surgeries in the past, removal of the ovaries, if they've had extensive pelvic surgeries affecting the ovaries, may also be a candidate for donor eggs. This is the similar graph to the one I showed you before, essentially showing how the quantity of eggs decreases, but also the quality of eggs. How do we measure quality of eggs, or what do we call quality of eggs? Quality of eggs really means the genetics within the egg, meaning that the aneuploidy rate, which is the number of embryos that are genetically abnormal, which at the time of fertilization or the time of ovulation come with some genetic issues, increases with age, and with it increases the miscarriage rate. So those two go hand in hand. Because of this, we have a lower live birth rate when we increase the age of the patient. So we have to take this into consideration once we decide or we recommend a treatment plan for a patient. So a lot of patients think, how is this process? How does it work? Essentially, you do the initial consultation with a physician, then with the IVF donor egg coordinator. You're going to have access and review the donor database. As a matter of fact, you can get access of a preliminary view of our donor pool from our website without even talking to anyone. You're going to select a donor. These donors have already been medically, genetically cleared. I'm going to go into it in a second. And then you're going to do some workup back in your home country, which basically includes blood testing, which nowadays can be ordered by mail, EKG to make sure you are healthy enough to carry a pregnancy, depending on your age, and also semen analysis to make sure your partner has adequate semen. We're going to do the coordination between the donor and the recipient. Then we're going to retrieve the donor eggs. We're going to fertilize them with your partners or with a donor sperm. And then we're going to do the embryo transfer. This is assuming you're not going to do genetic testing. So there's really two possible options. One is to use fresh or frozen eggs and frozen sperm, which logistically is a little bit easier for our patients because they don't have to spend that much time in Panama, and also the possibility of using fresh donor eggs and fresh sperm. So when we use fresh or frozen eggs with frozen sperm, we're going to ask the partner to either ship sperm to Panama, and this is easier than what it sounds, or fly to Panama for sperm freeze and to get to know our clinic. A lot of patients prefer to fly to Panama. That way they can actually meet the doctors, meet the team, get to know the clinic, and feel a little bit more comfortable with their journey. We also use this a lot for PGTA cycles, in which we're going to do a genetic screening or genetic testing on the embryos. And the reason for it is that the patient doesn't have to stay that much time in Panama. Most of the monitoring is going to be in your local area. And if we're able to have the sperm in Panama and the donors in Panama, well, we can send you reports on how the donor is progressing. We'll actually send you pictures of the embryos, and it minimizes the time you're going to be spending in Panama. It can be as little as 3 days, because if you have a genetically tested embryo that is already frozen, or if you're going to do a fresh transfer and we already have the sperm, you only have to come to Panama for the transfer itself. So you can arrive here, for example, on a Friday, transfer on a Saturday, and fly back on a Sunday. So that this option, a lot of patients prefer this option. The other option would be fresh eggs and fresh sperm, which means you're going to be arriving in Panama a couple of days prior to the egg donor retrieval, and the first part of the monitoring is going to be in your local area. Or you can choose to come to Panama and do the entire monitoring part of your endometrial preparation in Panama. You're going to spend more or less about 10 days from the day of the egg retrieval of the donors. We fertilize the eggs with donor sperm or with your partner's sperm. Then we wait until day 5 or blastocyst to then transfer the embryos in. There's a lot of advantages of using an in-house donor database, something that in the US is less frequent every year. Why? Because there are many commercial egg banks. This is going to eliminate costs for the patient and also for the clinic. It's also going to eliminate errors associated with third-party communication, which is very common. And we're going to be able to control the success rates because we're controlling the stimulation of the donors as well as the embryo culture. Our donors are going to be patients that are between 21 and 32 years of age. They have a normal BMI, meaning normal height and weight. They're non-smokers. They have a drug screening. We basically do all the FDA testing required, and we go beyond that. We do a genetic screening. So we test patients for hundreds of genetic disorders they may have. We're going to test them for personality disorders. We're going to have them sit down with a psychologist. We're going to do the entire infectious disease evaluation. So we're going to be above the standards of the FDA. And this is something that we know patients are looking for. So this is a quick view of our egg donor pool. It's not hard to select a donor. You can go in and look at our donors and then select the one you want more information about. Again, you can access our website and get a preview of our donor pool at no cost. Once you sit down with the IVF coordinator, she may be able to give you more information about a specific donor. So it's very easy, and you can find this in our website. A question people may have, and we know that in the US, donor egg treatment can be very expensive. What we do is that we offer the refund program that I was talking to you about, which is essentially 4 donor egg treatment cycles for a fixed fee. If you don't take home a baby, we'll give you 100% refund. We're including all the transfers and cryopreservation fees associated with it, as well as ICSI or assisted hatching or any procedure that may happen inside the lab. If you're going to do an individual cycle, the cost for 2021 is $7,500. It includes the cryopreservation of the embryos. If you're going to do the 100% refund program, it's going to be $14,400. And if you decide to do PGTA testing, it's going to be $3,000. So this is very accessible prices. And I'm sure that in the US, anything like this would be probably 3 times as much. So with this, I want to thank you all for joining us in this month's seminar. And I want to welcome you to visit our website at panamama.com or send us an email at hello@panamama.com. You can find our toll-free number in our website, and we will be more than happy to welcome you to Panama and take care of you and your family. Until next time.